1. Health Sport Book, Professional and Personal Experience Through Lifelong Learning and Regular Sport. PROPELLERS is project with a synergy between the fields of sport, physical activity, health, education, training and youth sector embodied in 4 intellectual outputs and in local awareness-raising activities spanning 6 European Union countries streamlined by a partnership of 8 organizations with different profiles, target group, experience, expertise and practices. IO1 aims to design an SportEnBook-Report that will be conceived as an informational and programmatic input to the following activities of the project and as a general, all-encompassing resource to the wider audience of stakeholders. Development of framework for research and assessment on level of participation in sport, physical health state, mental health and well-being of target population in partner countries. It takes 2 phases. Phase 1. Design of survey targets, instruments, guidelines and methodologies. Partners cooperatively devise the set of targets, instruments and methodologies underpinning a specific survey on sport participation, physical health state and mental state in all partner countries. Phase 2. Elaboration of a survey evaluation grid. Partners elaborated an evaluation grid outlining a set of parameters for assessing and processing the data to be collected by each partner in the survey at the national level. This evaluation grid was based in the following scientific and validated questionnaires. Socio-demographics and sport physical activity are 2 of the 4 questionnaires selected. Clicking the link it is possible to access to the full questionnaire. 15D and IFES are the other 2 questionnaires selected. Clicking the link it is possible to access to the full questionnaire. This is the example of Google Form full survey designed. For its execution, partner organizations submitted the survey elaborated by the consortium to the spectrum of targets selected. The survey was delivered through a combination of face-to-face interviews and online questionnaires. The total number of surveys carried out was 4.824, maintaining as a criterion of collecting a minimum of 500 questionnaires in the different countries that are part of the consortium: Bulgaria, Croatia, Greece, Italy, Spain and Poland. Partner organizations process the results of the survey into a comprehensive overview of the state-of-the-art in sport participation, physical health state, mental health and well-being of target categories, based on the evaluation grid developed. Main conclusions obtained were as follow. All countries have a similar percentage of moderate physical activity, with the exception of Croatia, that it is higher. Regarding to high physical activity, Poland is the leader, followed by Italy. Spain, Greece and especially Bulgaria show lower percentage. Physical activity category was not affected by education, disability or employment. However, individual data by country might be taken in consideration for developing tailored physical activity plans. The exception to previous conclusions are Italy, affected by education level, and Spain, affected by employment. Physical activity habits are different by countries, but all of them have 2 points in common. People do not practice physical activity because of lack of time and people do not engage as volunteer in physical activities. The main places to practice physical activities are outdoor or home, and as second option a sport club or fitness center, club. The main reason why people practice physical activity is to promote health, to improve physical condition or appearance. Relax or have fun are also important reasons too. Living area or local sports clubs are not a limitans to practice physical activity. The countries with the highest percentage of people with no walking problems are Greece and Italy. The country with the highest percentage of people who cannot walk is Croatia. The higher the academic level, the higher the percentage of people who can walk without problems. Conversely, the lower the academic level, the higher the percentage of people who cannot walk. As expected, there is a higher percentage of people with disabilities who have trouble walking. Among employed people there is a lower percentage of people who have mobility problems compared to those who are non-active. In general, 35% of the population has sleeping problems. The country with the highest percentage of people who sleep without problems is Bulgaria. The countries with the highest percentage of people with severe sleep problems are Spain and Poland. In general, the higher the educational level, the lower the percentage of people suffering from sleep problems. People with disabilities have a higher percentage of problems in order to be able to sleep without problems compared to people without disabilities. There is a higher percentage of people with sleep problems in those who are unemployed compared to those who are employed. The country where the highest percentage of people can carry out their usual activities is Greece, while Spain is the country with the highest percentage of people who find it impossible to carry out their usual activities. As in the case of mobility and sleep, the higher the level of education, the higher the percentage of people who can perform their usual activities without problems. There is a higher percentage of people who have problems performing their usual activities among people with disabilities than among people without disabilities. There is a higher percentage of people who have problems performing their usual activities among unemployed people than among employed people. The country with the highest percentage of people who think clearly and have no memory problems is Greece. The country with the highest percentage of people who have problems thinking clearly and have some memory problems is Bulgaria. The higher the level of education, the higher the percentage of people who think clearly and have no memory problems. People with disabilities have a higher percentage of memory problems. There is a higher percentage of employed people who think clearly and logically and have no memory problems compared to non-employed people. In general, around 30% of the population presents some level of sadness, melancholy or depression. The country with the lowest percentage of people with such problems is Spain. The country with the highest percentage of people with problems of sadness, melancholy or extreme depression is Italy. As for the level of education, it can be observed that the higher the level of education, the lower the percentage of people with extreme feelings of sadness, melancholy or depression. People with disabilities are found to have a higher percentage of feelings of sadness, melancholy or depression. A higher percentage of people with feelings of sadness, melancholy or depression are found among the unemployed. More than 50% of the population suffers from distress. This is a very high percentage. The country with the highest percentage of people who do not have any problems of distress is Bulgaria. In Greece, on the other hand, more than 70% of the people who answered the questionnaire declare that they suffer from distress. These data are extremely high. In the case of distress, it seems that those people with secondary education as the highest academic level achieved are those who present a higher percentage of people without distress. The higher the level of education, the higher the percentage of people who do not have physical discomfort. More than 50% of people with disabilities have physical problems. There is a much higher percentage of people without disabilities who indicate that they have no physical problems compared to people with disabilities. A higher percentage of unemployed people have physical discomfort. The country where the highest percentage of people feel healthy and energetic is Spain. The case of Poland stands out, where more than 50% of the respondents feel tired to varying degrees. In this question it seems that there is no clear pattern between level of education and feeling healthy and energetic. A higher percentage of people without disabilities feel healthy and energetic. A higher percentage of people out of work feel healthy and energetic. According to results, the PROPELLERS project foresees the elaboration of local and national activity plans. Partner organizations elaborated country-tailored activity plans at the local and national level based on the country findings with special focus on people that are not in education, employment, or training, and people with disabilities. Action plans designed at the country level comprise the following activities: organization and implementation of local events, actions, sport days, info days and workshops in order to promote voluntary activity and increase participation in sport at the level of the population, with a specific focus on the targeted categories: children, adults, youth, disadvantaged targets. Communicating and disseminating the philosophy and practice of sport for all. Promotion of tools of education through sport in educational institutions, associations, youth organizations, institutions offering disability support services with the involvement of volunteers to be carried out with non-formal educational methods. Partner organizations process the county findings and activity plans developed into a comprehensive report outlining the mapping of state-of-the-art in the field of sport participation, physical health state, mental health and well-being in partner countries. And finally, this is the Health SportEnBook book which contains all the information and is the final product of this intellectual output one from the project.